in this stem, we have a 45-year-old female patient with locally advanced breast cancer who has completed multiple cycles of chemotherapy, specifically in this case, doxorubicin, cyclophosphamide, and docetaxel. She now presents to you with nail changes, and these changes are described as diffuse brown discoloration with longitudinal bands across all nails. So this is diffuse involvement of multiple nails, and it's occurring after chemotherapy. This should immediately point us towards a chemotherapy-induced melanonychia, also known as melanonychia striata. This is an expected side effect of chemotherapy. The mechanism behind this change involves stimulation of melanocytes in the nail matrix, and this leads to increased pigmentation and the appearance of banding across the nail plate. So the drugs responsible for this include alkylating agents, for example, taxanes such as docetaxel, which was given in this case. Also antimetabolites like cyclophosphamide, anthracyclines such as doxorubicin, and anti-tumor antibiotics. So that the patient's exact regime that she was given fits perfectly for the cause of this melanonychia striata. So in terms of timing, these changes usually appear around 1 to 2 months after starting chemotherapy, and they can be associated with skin and mucosal hyperpigmentation as well. So now the key step is to rule out anything dangerous, particularly subungual melanoma. So in order to rule that out, we ask ourselves a couple of questions. Is this affecting only one nails? So in the case of this stem, no, it's actually affecting multiple nails. And then we got to ask, is there any irregular borders or asymmetry based off our stem? No. Is there pigment extending onto the surrounding skin of the nails? This is known as Hutchinson sign. And no, we don't have any of that in our stem. So overall, we can say there are no red flags in this case, which tells us this is benign and treatment related. So let's go through the options we have here. So warm compress, it's not really effective in this case, as it's not an infection or inflammatory condition. So this is not going to really do much for our patient. Topical steroids, again, there's no real role here, as it's not an inflammatory condition. Biopsy of the nails, in this case it's not warranted because this is an expected side effect from the chemotherapy, and there are no suspicious features that we saw. So if we had suspicious features, then this would have been a viable option. Discontinuing chemotherapy, this is an incorrect option because this is a harmless cosmetic change, and the patient benefits more from continuing life-saving cancer treatment. So that's why this option is wrong. So this leaves us with the correct answer, which is reassuring the patient. So we can select that option and submit, and there we go. If you guys are preparing to sit the AMC, highly recommend you guys check out the website. There's a link directly on our page. There's thousands of questions on there for you to review, and we've had hundreds of students who have used these exact questions from the question bank to pass the AMC Part 1 exams. We thank you guys for watching the video and wish you all the best of luck with your exam preparations.